Let's be real. When you're in nursing school or just living on a budget, finding high quality clothes that don't feel budget can be a challenge. That's why I'm so excited about Quince. As I start transitioning my closet for fall, I've been looking for easy, affordable staples I can wear on repeat, and Quince totally delivers. Their styles are elevated but simple. Think cozy sweaters, washable silk tops, classic jeans, all at prices that actually make sense. Right now, I've got my eye on the lightweight cotton cashmere link stitch dolman sweater. It's so cute. And the 100% organic cotton boyfriend crew sweater. Both are under $40. That's seriously unheard of for pieces of this quality. Quince keeps prices low by cutting out the middlemen, and they only partner with factories that use ethical and responsible practices. Elevate your fall wardrobe essentials with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. So you've probably noticed, if you've been in the clinical setting for any amount of time, that there are two very similar sounding lab tests that are part of your coagulation studies, the PTT and the aPTT. Are they the same? Are they different? Let's take a quick look. So the PTT and aPTT are tests that look at the intrinsic pathway of clot formation. Specifically, it's looking at blood clotting factors such as fibrinogen and thrombin, as well as factors 5 and then factors 8 through 12. So when any of these are deficient, such as in hemophilia A or B, or DIC, then the patient will have what is called a prolonged partial thromboplastin time. PTT stands for partial thromboplastin time. That's very hard to say. That's why we just say PTT. And what this means is that it takes longer for the blood to clot. So the patient's at higher risk for bleeding. Other reasons for prolongation include liver disease, and that's because coagulation factors are made in the liver. So if your patient has liver disease, especially advanced liver disease, they're going to be very bleedy or very likely to bleed. Also, biliary obstruction can cause prolonged PTT, and that's because with biliary obstruction, digestion is impaired, and factors that are vitamin K dependent will be affected. So there you go, a little bit of background on that. So this test also looks at clotting times in patients receiving heparin, and that's the key, most common reason you're going to be looking at the PTT or aPTT is because your patient is getting heparin, and that's because heparin inactivates factor 2, which is prothrombin, and interrupts the formation of thromboplastin. Both of these disruptions prolong that clotting pathway and increase the PTT or the aPTT. Now, as you probably recognize, there's two forms of this test, the PTT, which is partial thromboplastin time, and the aPTT, which is the activated partial thromboplastin time. The only difference between these two tests is that the activated test, or the aPTT, adds activators to that test reagent to shorten the normal clotting time and provide a narrow normal range. What this means is that lab results are going to differ and need to be interpreted accurately depending on if you're looking at a PTT or an aPTT. So the normal range for a PTT is 60 to 70 seconds, and the normal range for aPTT is 30 to 40 seconds. So when you're looking at your lab results, you want to make sure you're looking at it in the right context. If you hear that your patient's aPTT is 60 seconds, and you thought they were talking about the PTT, you could be misinterpreting that as a normal result and not a prolonged result. So in addition to heparin, there are some other medications that can prolong the partial thromboplastin time. So when you're looking at your lab results, when you're looking at your patient's whole clinical picture, it's important to tie everything together. So if you see that your patient has a prolonged PTT or aPTT, but they're not getting heparin, look and see if they have anything else going on. Do they have liver disease? Do they have biliary obstruction? Are they on another medication that can prolong it, like an antihistamine, salicylates, ascorbic acid, and thorazine? Those are some medications that can prolong the PTT that aren't heparin. So that's just another little reminder to always be looking at your patient's whole clinical picture, not just making assumptions, and really taking everything into account. I hope that helped you understand the key difference between the PTT and the aPTT, and I will see you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
On most sportsbooks, an injury ruins your whole football parlay, but not on Fanatics. They have Fair Play Insurance, which protects your football player prop bets from injury for the entire first half, every single game, all season long. So even if a player goes down early, you still won't take the L. Why risk it if you don't have to? Keep your bets intact and switch to Fanatics Sportsbook. Winning hits different here. Must be 21 plus. Gambling problem? Call 1-800-GAMBLER. Offer not available in all states. Terms apply. See Fanatics Sportsbook app.